What's up, gamers? Today we're going to be playing Cookie Cookie. Before we get into it, make sure to like and subscribe. And our new subscriber goal is to pass my friend Jake in subscribers. He's around 1,000. I did some off-camera things, so let's hop right in.
Booking.com has stays for absolutely anyone. Imagine you're a merman. Find a beach resort for your merman.
Off-camera earnings. Do. Off-camera earnings. Do. I also like Cookie Clicker a lot. So.
From RuPaul's Drag Race to Kim Kardashian.
Still gonna put Dr. Mike up here because
there's a variety of reality shows, but we're gonna
he's the
react
man.
to some of the most interesting medical scenes. Let's get started.
The man.
You got this, sister. You were super close. Right in the kisser. Show that night who's boss.
That's a weird game.
Oh, showed who's boss.
Oh, I did not expect that. I thought it was gonna I don't know what I expected. Oh my God, she got rocked right in the face.
Are you okay? I can't feel my face.
And the watermelon broke. She's lucky that she didn't lose teeth, broken bones, no cuts.
You waiting for the bumping million?
I get 50 million in a second. Takes less than a minute.
No. What do you have?
The lobster tail.
The lobster sometimes has Vibrio, which is a type of bacteria that most of the time is pretty self-limited, meaning that it goes.
I'm gonna go get a snack, and if I miss a golden cookie, I'm going to
In
shoot
severe
myself in the
cases,
head.
We do prescribe antibiotics for this.
Seriously.
Comment down below if I
I
miss
can
one.
smell the ammonia.
Smelling ammonia means there's some kind of decomposition happening, which likely means that the lobster wasn't prepared as freshly, which means that there's some of that Vibrio that we just talked about.
It's been pulled apart and then decomposed. That's what makes it bad.
Well, it's not the ammonia that makes it bad. It's still the bacteria, but the ammonia that is released by the bacteria, so it signals the presence of the bacteria. Oh, my Staten Island friends.
So my name is Justin, and your heart is okay, as far as you know?
As far as can you feel the difference between love and lust?
And so you can feel the difference between like love and lust?
Yeah.
Okay.
Patient's gotta be so confused. It's like sometimes a patient will come in for like an unknown arthritis, and then we'll ask about sexual history, and they'll be like, "Why are you asking about sexual history?" I'm like, gonorrhea can cause arthritis. The more you know.
Let me take your temperature.
That's like the mom's way that they feel the child. Not gonna lie, back of my hand is pretty good at knowing temperature. Not tested, not validated, but feels like it's pretty good.
Why don't you check this guy's reflexes, Sal?
Check your reflexes?
Oh, there you go.
See this?
You're hitting it a little bit too high, and he's hitting it directly on the
Leg is good.
All right.
Like dead.
This
And
happens
back.
all the time, by the way. Not the laughing noise, but like the fact that one leg has good reflexes and the other, once they see what I do, doesn't work. It's because the patient's actively
0.9?
keeping it compressed. In order for the reflex to work, the muscle has to be fully relaxed. So in a lot of those cases, I actually ask the patient, usually a child, to pull their hands apart as hard as they can and look up at the ceiling. And when they do that, they automatically relax. A cool thing that I do is when I don't have a reflex hammer available, I'm like one of these old school doctors. I use this. And it's like, wow, I really do that. I'm like, yeah, we're having fun in the hospital.
I have to finish this paper. I'm swamped. No one told me college would be so.
I imagine a big injury's incoming.
The knee.
Yes.
Someone's gonna fall.
I land and I feel my knee pop.
If it was the front leg, my guess is it's an ACL.
You need time to heal. She spills the tea. She spoke to the doctor personally herself and let me know. She was like, you have to have immediate surgery, you need to tear your ACL.
Mechanism of injury. I keep saying it on this channel. It's one of the most important things in making a diagnosis when it comes to musculoskeletal complaint. That's why when patients are like, Doc, can you stop asking me questions about what's going on and just examine my leg? I'm like, look, examination is part of it for sure, but I need to get the mechanism of injury. Where were you sitting? How did you fall? Which leg did you fall on? What motion were you making? How high was the step? All these questions sound silly, but are of utmost importance.
I don't know what should be the goal for this game. I mean, for this
Never
video.
want to hear oh shit in the operating room or in the bathroom.
So,
Slick disc and her pinching nerves. And I just was taking a shit.
I can't believe this. This feels scripted. This feels like Impractical Jokers.
Oh, why is happening? What's your step? I gotta go left foot first. Go.
So discs are these padded little sacs that are function in between the vertebrae, which are the bones of the spine. These sacs provide cushioning, and sometimes if there's a herniation or a bulge in these sacs,
We're
they
getting a
actually end up
billion.
putting pressure on the nerves that end up giving sensation and motor function to the lower parts of your body, aka your legs. So if you get pressure on a nerve from a disc bulge high up, you essentially get a pinched nerve, and then anything below the level of that nerve is impacted, which means the strength of your legs, the pain that you're experiencing, weird sensory changes, because nerves don't like to have pressure put on them.
Oh yeah, dude.
He's getting swollen there too.
After being crushed between two deck boards,
Ooh.
Andy's finger swells fast.
So the problem is when you have a subungual hematoma, which is an enlarging bruise, a tumor of blood starting to spread underneath the nail, that pressure expands and it becomes problematic. Commonly, runners who experience this type of blood pockets under their nails will heat up a paper clip and actually put it on the surface of the nail, therefore melting the nail, which has no sensation, and therefore creating a hole and allowing the blood to pool out.
Andy braces himself for some old school boat medicine.
Look, they're doing it!
Then we're gonna stick it up. Okay, get it done.
I don't know why they're acting like it's gonna hurt. It should not
Billion.
hurt if they do it correctly.
Oh my god!
Cauterizing the wound can actually
Wait.
become problematic because when you cauterize
I
the
got
wound,
that
you
much?
stop the bleeding, and then that can create a blockage, and then
Oh!
the
Wait, no,
hematoma
that
keeps
wasn't that
being
much. I
enlarged.
just,
John Walczek
I
has
just wanna
been
get
nursing
prepared
a
for something
badly
good.
infected finger.
Finger infections are incredibly problematic. There are so many places for them to spread. Think about how many different joints there are in the hand. Every connection is an area where septic arthritis can begin. The bones, the tiny little bones of the hand, that's an osteomyelitis waiting to happen. Oh, that's really bad.
It was brought to my attention about 4 days ago, and it was pretty well advanced. All the telltale signs. It was red. It was swollen. It was hot.
That looks like a septic arthritis. At this point, I'm starting IV antibiotics.
Did you injure it in some way?
Must have been stuck by a crab or a codfish or
Okay,
something. But
that's kind of cut.
So that means it's a deeper infection because if you're getting poked by something, that means it's going deeper in the joint, makes it more likely to be dangerous. There's also toxins inside some of the seafood.
what we did is we soaked it in a warm saline solution.
Okay.
And the first time we lanced this thing, we hardly got anything out of it.
So how did you land?
Big sewing.
Okay, sterilized so you know
Yep.
it just popped in?
I don't know if popping is ideal. I don't see really a clear abscess, which is a formation of pus and bacterial products inside a closed environment. I don't really see that here. I just see generalized swelling.
The next day, they worked it after a hot saline soak. It came up with a lot. And it's been coming up with a lot until yesterday.
We need a hand surgeon. We need
Alright,
an
wait.
antibiotic. We probably need a proper scan to see what's inside, to see if there's an abscess.
I think that you definitely come into the clinic with me. Actually need some IV antibiotics.
I agree. But again, with the hand, you don't want bone destructions. You want to act early if you suspect septic arthritis or osteomyelitis.
Let's try to blast through this walrus and get it off board.
Why are they trying to get a walrus on? What is happening right now? That water looks really cold
The
too.
guy's maniac.
If Freddy doesn't get out of the water in 60 seconds, hypothermia could set in.
Hypothermia is really dangerous. Obviously, there's stages to hypothermia. You have mild, moderate, severe. The severe hypothermia can actually get so bad that it can lead to full-on cardiac arrest. Hypothermia is no joke. Even for severe hypothermia, we actually do active, like intravascular warming in order to help people warm up because the hypothermia can be that bad. For those who have cardiac arrest and their heart stops, we actually do like a hypothermia protocol to help slow down the cellular activity and potentially mitigate some of the damage from a cardiac arrest. Because there's some post-cardiac inflammatory changes that happen
Alright.
after the heart stops and then gets restarted.
Everything seems to be going well. And then the girls get to their second jump.
Oh,
She just twisted her ankle. Oh my god. Can you stand on it?
Alright,
that's actually
I'm gonna go down again
test
for a
to do
for a sec.
because weight bearing immediately after the injury is one of the Ottawa ankle rules that we use to decide whether or not a patient needs an X-ray. It's definitely like a grade 1 or grade 2 ankle sprain, just solely based on what happened, solely based on how she's feeling right now, that she's able to point. This is a mild injury because if there's a very serious tear or a very serious fracture, weight bearing is near impossible. movement is near impossible with the amount of swelling that happens quickly, especially in kids. You obviously can't compete with an ankle like this, but it's not a very long recovery as long as you do it properly.
Looking at the x-rays, that looks like a stress fracture.
Whoa, I thought she fell on her ankle. You know what this might be? She might have an ankle sprain, and then because they got an x-ray when they might not have needed to, I don't know exactly what happened, but then incidentally also found a stress fracture from constantly jumping and doing all those things, which happens in kids.
She really needs to go all out to impress the Joffrey Ballet Scout.
I actually have had patients that come in with stress fractures of, let's say, the tibia, which is their shin bone, preparing to run for like the New York City Marathon. I diagnose them with a stress fracture. I'm like, you cannot compete in the marathon in the next 2 weeks. And they say, well, I'm going to do it anyway because I've trained for this so long and hard. There's no way I'm going to give up now. And I have to warn them, very brutally honestly, that by running in the marathon, you could snap your shin bone in the middle of the race. And it happens. More than we'd like to talk about.
After just 14 hours in the desert, Dr. Drew Bensky is feeling severely unwell.
How you feeling?
Bad.
You move on. Go see your doctor.
They tell you the doctor, go see the doctor. I love when people tell me.
Dr. Drew is with the camp medic.
Suspect most likely diagnosis is dehydration. Dehydration is part of it, but what's leading to dehydration? He pointed out the symptom, but what's the problem?
Is there a point to IV?
If I do an IV, I think we put you off the course. IV is quicker, for sure, and if you are not delivering enough blood flow to vital structures, then yeah, IV is really important. If you're just like a little nauseous, drinking water, you'll hydrate.
With severe heat exhaustion,
Heat exhaustion.
Dr. Drew is being medically withdrawn from the course.
Wow. Bring Dr. Mike on that show.
If you hate constantly being sworn by ads, you need to download Pi. Pi is a free extension that blocks ads on your favorite sites. It even blocks ads that you didn't even know were ads. If you opt in, you can earn rewards by seeing a limited number of ads.
Pretty, right? Good luck finding another ad blocker out there that does that.
It even has a visual mode where you can literally watch the ads disappear. Like, how satisfying is that? Millions of users are already blocking their ads with Pi, so what are you waiting for? It takes like 5 seconds to install, so honestly, just give it a try.
Literally, my whole head feels bruised because it's been pounding for so long. I've been throwing up blood. It's so intense.
I thought this was just a simple migraine, but throwing up blood is something else is going on. Migraines can be so debilitating that it can severely impact quality of life. That's why there's medications that we use that are abortive in nature, meaning that they break a migraine when it starts. Ideally, you take the medication very early at the first onset of the headache. There's also medications that we can give that are prophylactic in nature, preventative. Honestly, all those symptoms are really reasons to go visit an ER.
Are you on any medication?
I'm on that birth control.
Migraines with auras, meaning that you start seeing like a little visual sign that the migraine is coming on, is actually a risk factor and almost a contraindication to not taking birth control because it increases the risk for developing a clot.
There was nothing left in me to throw up that it was
Alright, I'm back.
just, like,
Wait, what happened?
You can actually
What
develop
happened?
something known as a Mallory waist tear, which is a tear of the esophagus from constant
Wait, how did I get
action of
Billy?
coming out. And then if it gets really problematic, it
Oh,
can
wow.
develop into Voorhees syndrome. You
Alright.
get a complete tear, and obviously that's
That's interesting.
Today you're going to do MRI and MRA of your brain.
the times where we decide to do an MRI with contrast. There's a sudden change in frequency or intensity of headaches that have been lifelong or have a long enough history. Risk factors like waking up in the morning with a headache, headaches that worsen with exertion, most specifically sexual exertion. That could be a sign that there's an aneurysm there, so you really want that MRI with contrast done. Ones that happen with new neurologic features like the vision loss that she was talking about. All those are really strong red flags that I would get an MRI.
it's just so annoying that I get them, and I wish there was like, this is why.
Some of the best evidence that we have for medications for migraines is a medication that's a triptan in combination with a non-steroidal inflammatory known as naproxen.
Oh god, and my hands are a bit
You know, I think that's gonna be it for this episode of Cookie
I
Clicker.
don't know why
See
drinking
ya
not enough water.
Tomorrow or today, I don't know, just for right now. See ya!